What causes urinary retention after Botox for OAB? Imagine a treatment that can help reduce the urgent need to urinate and incontinence by calming overactive bladder muscles. That treatment is Botox injections, which are used to manage overactive bladder. But sometimes, after receiving Botox, some people find they have trouble emptying their bladder completely. This is called urinary retention. So, what causes this to happen? Botox works by blocking nerve signals that tell the bladder muscle to contract. When injected into the bladder muscle, known as the detrusor muscle, Botox prevents the releases of a chemical called acetylcholine. This chemical normally causes the muscle to tighten and contract. By blocking it, Botox reduces involuntary contractions that cause urgency and leakage. However, because it also weakens the muscle's ability to contract fully, the bladder may not empty completely during urination. This incomplete emptying leads to urine being left behind, which is called post-vide residual volume. If enough urine remains, it can cause difficulty or even an inability to urinate, which is urinary retention. The likelihood of developing urinary retention depends on several factors. First, the dose of Botox matters. Higher doses, like 200 units, tend to increase the risk compared to lower doses such as 100 units. Second, a person's baseline bladder function plays a role. Those who already have a higher residual volume before treatment, especially over 100 milliliters, are more prone to retention. Third, individual characteristics influence risk. Men, especially those with prostate issues, and people with conditions like diabetes, which can affect nerve function, are more vulnerable. Fourth, patients with neurological conditions such as spinal cord injury or multiple sclerosis have a higher chance of retention because their nerve signals are already impaired. It's important to note that some patients may need to perform intermittent self-catheterization temporarily if they cannot empty their bladder fully. This helps prevent complications like urinary tract infections, which can happen if urine stays in the bladder too long. In clinical studies, about 6% of people treated with Botox for overactive bladder experienced urinary retention that required temporary catheter use. Usually, this lasts a few weeks to a few months, with the median duration around 2 months, but it can vary from person to person. In summary, urinary retention after Botox for overactive bladder happens because the medication weakens the bladder muscle's ability to contract fully. Factors like higher doses, pre-existing bladder issues, male gender, diabetes, and neurological problems increase the risk. Proper patient evaluation and close monitoring before and after treatment are essential to minimize this risk and manage it effectively if it occurs. Always consult with a healthcare professional to determine if Botox is suitable for you and to discuss potential side effects and management strategies.